morning, sir.
Today we will be discussing the lecture further about the care of the newborn, especially the preterm. So the first point in the care of such children is that you must prevent infection. To prevent infection, it is very essential. I told you the C's in the previous lecture. The surface where to lie the child should be clean, hands should be clean, and the scissor, cloth, and tongue and the cord tie all should be sterilized one. After delivery also, when you keep the child should be kept in the lap of the mother, bedside of the patient. The mother's hygiene should also be good. This should be taught in the antenatal period when the mother is coming to you for her ANC checkups. The nails should be cut, hands should be washed, and those close relatives who are taking care of the child, they should also wash their hands with soap and water to prevent any infection. Second is the rooming in. What is the rooming in? Rooming in means the child should be in the same room as where the mother is lying, and in the same bed where the mother is placed. It should not be like that the mother is in the bed and the visitors or the relatives, they are picking up the baby in their lap and taking them to the various wards or corridors. This will make the child prone to infections. So visitors should be minimum, and they should be stopped from each visitor from touching the child. Some are in the habit of putting the finger into the mouth. That is also a wrong practice. Baby by the side of mother, that we have discussed. With these measures, you will be able to prevent the infection of the child. Now the second important point in these children is thermoregulation. So these children, premature, they have not yet developed the thermoregulatory mechanism which will keep their temperature at a constant level. So they tend to get into hypothermia. So the practice of keeping the fans at high speed and AC to make the room cool, that should be discarded, because when the child is born, the child is wet and he rapidly goes into hypothermia. You must have also noticed, आपने भी देखा होगा जब आप बाथ करके बाहर आते हो, if the fan is on, you also start feeling cold. You immediately switch off the fan. So by that mechanism, we have to switch off the fan when the child is born. Though it may be uncomfortable for the caretakers, but it should be avoided. And second is after birth KMC. KMC stands for, you can note down, kangaroo mother care. The child should be placed on the chest of the mother between the two breasts, and the head and feet, they can be covered, but the rest of the body is directly in contact with the mother's body. So that will transfer the heat of the mother to the child, and it will help in keeping the temperature of the child maintained, avoiding the hypothermia. So after birth also, these premature children, they can be regularly practiced by KMC to maintain the temperature. Or those children who are in the hospital under the servo controlled warmer, the mechanism of servo controlled warmer should be set according to their maturity so as to avoid the hypothermia. In SNCU also, you have to be very careful. There is a direct reading coming on the display on the monitors, so you can set the temperature according to their maturity, so that they do not go into hypothermia. The servo warmers are so designed that whenever the temperature starts falling, they switch on automatically and start giving heat to the child. If the child is too cold, they produce more heat. If the child's temperature is nearby or normal, they stop producing any heat. That's why they are called servo warmers. So temperature monitoring, this can be done by the axillary temperature or by the sometimes by the rectal temperature, but this is these days avoided. In those children who are under the servo warmer, their automatic reading is displayed on the monitor. Direct heating should be avoided. What is meant by direct heating? That as you have seen in the winter, if you place a heater by your side, that side becomes very hot. You start feeling uncomfortable. Either कि थोड़ा इसको परे करो or you go away from the direct source of heat. So this can harm the newborn and can cause burn injuries also. So this direct heating should always be avoided. Now what about the fluid and nutrients in these premature children? So the coordinated sucking is developed by 32 to 34 weeks. So if you have to be sure that the child can swallow properly the feed whichever the child is being given. If there is sometimes there may be tendency of regurgitation and aspiration. So this has to be avoided. You have to feed the child by keeping the child's neck and upper abdomen at a higher plane than the rest of the body. The mother should also feed the child in that position, that is semi-reclining position, to avoid this regurgitation. These children, they are also prone to abdominal distension. What does this mean? That when after feeding, because of the sluggish bowel movements and delayed gastric emptying, the abdominal distension takes place. If the abdominal distension is more and persistent, then you may have to stop the feeding also which you are giving. Sometimes after feeding, if you are giving by nasogastric feed, before giving the next feed, you withdraw the milk from the abdomen. If the residual quantity is more, say after 3-4 hours, if the residual quantity in the stomach is more, this means the milk has not been digested. So it is still in the stomach. So then that condition, that you have to either decrease the quantity of milk or you have to postpone the oral feeding for a few days. So because there is a risk of NEC. What is NEC? Necrotizing enterocolitis. You can note down necrotizing enterocolitis. So the feeding should be given, frequent feeding at 3 to 4 hours or 2 to 3 hours as per doctor's orders you have to give, and the feeds has to be increased slowly. The calculation, let us say if you are giving by formula feeding, what does this formula feeding mean? This is the artificial milk, जो डब्बे वाला दूध होता है, that is called formula feeding. 60 to 90 ml per kg per day if you are starting, and then it has to be increased slowly. Let us say if you are giving say at the rate of 50 ml per kg, then the rest you have to give by IV method, so as to complete the requirement. जितनी बच्चे की requirement है वो आपने देनी है. यदि 60 और 90 ले रहा है बच्चा तो ओके, आपने एक फीड दी, आफ्टर 3 hours you are giving the next feed, उसके स्टमक में आपने एस्पिरेट करके देखा, कोई रेमिनेंट फीड नहीं थी, देन यू कैन गो अहेड एंड slowly every day you can increase the feed. But otherwise, if the child is tolerating but small amounts, then the deficit, whatever deficit is there, that has to be completed by IV fluids, so that the complete requirement is there. So some of the children, they are too weak, they are not able to place down the breast milk, they are not sucking. So what to do in such cases? One is EBM. What does this mean? You wrote down. EBM means expressed breast milk. मदर अपना दूध निकाल लेगी और देन यू कैन गिव दिस फीड. अब उस फीड को कैसे देना है? आइदर बाई NG फीड, या तो उसके पेट में नली डाल दो, उससे वो फीड आप दे सकते हो मदर्स मिल्क, और बाई प्लादी. व्हाट इज दिस प्लादी? ये प्लादी, दिस इज लाइक दिस, right? So this is a long tipped spoon, as you have seen in the, जैसे आप मंदिर में वो दिया जलाते हो तो उसका जैसे दिए वाला हो ना, लंबा हो उसका, तो then you can slowly feed the child with that, just like a spoon देते हो. स्पून से नहीं बच्चा ले सकता, with the tip of the pladi he can slowly swallow. This is also a very good method. It will prevent the regurgitation also. When the child is weak, premature, and you are giving the feed by these methods, then you must always look for hypoglycemia, कि बच्चा कहीं hypoglycemia में तो नहीं जा रहा. What you have to do? You will be monitoring the blood sugar levels of the premature child frequently. If the child is going into hypoglycemia, then you will need to start the treatment for hypoglycemia. That we will be discussing whenever we will discuss the hypoglycemia. So meanwhile, if you want to ask, you can ask. Okay, thank you.